Hello everyone. In the today's session, we are going to discuss about the basic life support. So before discussing about the basic life support, we are going to discuss about the difference between the cardiac arrest and heart attack. So I'll tell you the basic difference between these two terms. The first one is about the cardiac arrest. In cardiac arrest, there is sudden unconsciousness. If I talk about the heart attack, in heart attack, the person may able to see the sign and symptom, because in case of the cardiac arrest, there is no any clinical sign and symptoms are present. But in case of the heart attack, there is a presence of sign and symptom. That means the person will able to show some clinical symptom which may represent the signs of the heart attack condition. So always remember, the heart attack can convert into the cardiac arrest, but the cardiac arrest cannot be converted into the heart attack condition. So now I am going to tell you about the basic life support demonstration. Means how you are going to approach the patient if you found up someone is lying on the roadside in an unconscious stage. So first of all, the first step in the BLS is that is about the scene safety. So first you have to make the scene safe for yourself as well as for the patient, because first you have to seek for your safety, then only you are going to protect the patient from the cardiac arrest or the other kind of the significant problem. So first you have to make whether the scene is safe for you or not. The second step in the BLS is that is about the check for the consciousness or check for the response. Then what we are going to do is we have to tap the shoulder of the patient and we have to tell the patient, hello sir, are you okay? Are you able to hear me? Hello sir, are you able to hear me? So by tapping the shoulder of the patient, you have to assess the level of consciousness, whether patient is conscious or not. For example, if patient is not conscious, then what you have to do is you have to seek for the help. Then you can call someone for the help. You can tell anybody that you can call the ambulance or you can go and get the AED1. So after the call for help, the next step is about the check for the pulse as well as for the respiration. Now I am going to tell you how you are going to check for the pulse as well as for the respiration. So here you can see this is your trachea. So in trachea, the upper portion is known as the thyroid cartilage. There will be a cricothyroid membrane and this will be the cricoid cartilage. So whenever you are going to check the pulse, so we have to check the carotid pulse. So you have to palpate the trachea with the help, either you can use your 3 fingers or 2 fingers, totally depends upon you. You can use your 2 fingers also and you can use your 3 fingers also. So what you can do is you can palpate the trachea and then you can slide your fingers towards your side, and here you may able to find one groove which is known as your sternocleidoid muscle, and here you may able to feel your carotid pulse. So simply what you have to do is you have to palpate the trachea, then slide your fingers towards your side, and here you may able to see your carotid pulse you can feel. So always remember, whenever you are going to check the pulse, you have to assess the nearest side. Do not go for the farthest side, and this technique is the wrong technique for checking the pulse. So what you can do is you can palpate the trachea, either you can use your 2 fingers or 3 fingers. You can, so for example in this case I am using my 2 fingers. So what I will do is I will palpate the trachea and then I will slide the fingers towards my side, and then with the help of this finger pads I am going to palpate the pulse, and with the help of the eyes I'm going to see the chest rise, whether there is a chest rise or not. So with the help of 2 fingers I'll palpate the pulse, that is carotid pulse, and with the help of the eyes I'm going to see the chest rise. So in this mechanism you are going to spend approximately 5 seconds but not more than 10 seconds. For example, whenever you are going to check the pulse as well as the respiration, then you have to spend approximately 5 seconds but not more than 10 seconds. So after checking the pulse as well as the respiration, for example, here the 2 scenarios are there. For example, if patient is having a pulse but there is no respiration, so what you will do is you will start with the bag mask ventilation. That means you have to deliver the oxygenation in the form of the bag mask. But for example, the second case is, suppose if you are checking the pulse as well as the respiration and you may not able to find the pulse as well as the chest rise, that means there is no pulse, no respiration. So what you have to do is you have to start with the compression. So now how you are going to do the compression? So what you have to do is, whenever you are going to apply the hands in the patient chest while you are going to press the chest of, while you are going to press the heart of the patient, because whenever we are going to press the heart, that our main motto is that we have to, by pressing the heart, the brain get perfused and the body will start functioning. So what we have to do is, that is where we have to place the palm of the hand, that is your, this is your xiphoid process, that is 2 fingers above the xiphoid process and below the breastbone. So what you will do is, with the help of your one hand, you are going to apply the one hand that is below the breastbone and 2 fingers above the xiphoid process, and then with the help of the other hand you are going to lock your lower hand, and then what you can do is, you can start doing the compression. But always remember, whenever you are start doing the compression, your hand should be straight, and your hand should be straight as well as you are perpendicular towards the patient. That means you have to maintain the 90-degree angle. Suppose if you are doing compression like this, then that means you are not giving an effective compression, and do not do compression like this also. So where you are going to place your hand, there you have to stuck your hand over the specific area, then lock your hand, then your elbow should be straight, and you have to start pressing the chest of the patient so that the brain get perfused and patient may get the sufficient amount of oxygen, glucose and the blood in the brain, and brain will start working. So what you will do is, you will press the chest. Now the next thing is, whenever you are going to press the chest, you have to maintain the depth. The depth is approximately 5 to 6 centimeter you have to maintain. But if, for example, if you are pressing the chest more than 6 or 7 centimeter, that means you can break the ribs of the patient. So the depth is approximately, that is 5 to 6 centimeter in inches, 2 to 2.5 inches. And your hand should be in a straight manner. So whenever you will press, maintain the depth, and you have to maintain the rate also. The rate is approximately 100 to 120 per minute. And after this, whenever you are going to press it, so approximately 30:2 mechanism we have to maintain. It means the ratio will be 30:2. 30 means 30 compression and 2 breath. For example, if you are in the roadside, so you can go with the mouth to mouth breath. If you are in hospital setting, then you can go with the ambu bag. We'll discuss about the basic concept of ambu later, but first I'll show you how you are going to press the chest of the patient. So what you will do is, you have to apply the hands, that is below the breastbone, 2 fingers above the xiphoid process, then you will lock your hand and start doing compression by making the patient, you are should be perpendicular to the patient. That means you have to maintain the 90-degree angle, and then you will press the chest, and you have to count up to 30. That is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. So after giving 30 compression, now you are moving towards the respiration side. As per the AHA recommendation, for example, if you are not comfortable in the mouth to mouth breath, so what you can do is, you can skip the breath. Why so? Because we as a normal adult, adults are suffering from the cardiac arrest or the heart attack condition. But in case if you are dealing with the infants or the neonates, they are suffering from the respiratory arrest, and in that case respiration is important, because the respiratory arrest can convert into the cardiac arrest. That's why we are going to press the chest of the infants also. So now I will tell you how you are going to give the mouth to mouth breath. So what you can do is, this part of the hand you are going to place it over the patient head area. With the help of these 2 fingers you are going to pinch the nose. With the help of this hand you are going to give the head tilt chin lift maneuver so that your airway will become patent. Now take a deep breath, deliver first breath. You have to make your mouth seal with the patient mouth. Deliver first breath. Now wait for 5 seconds. You can count like this: 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000. Again deliver second breath. So if you don't have a bag mask device or a pocket mask, then you can go with the mouth to mouth breath. But in case if you are not comfortable in mouth to mouth breath, then you can skip the breath. You can continue with the compression only. Next thing is about the bag mask. So I'll tell you about the basic component of this bag mask, as well as how you are going to use the bag mask in the patient. So this is known as your ambu bag, and this one is the mask of the ambu. So ideally, ambu is an artificial manual breathing unit, and it is an ideal device for giving the ventilation to the patient. The ideal name of this ambu bag is bag valve mask or bag mask ventilation device. This whole part is known as the it is back. This is known as the pop-off valve, this portion. This is the connector, and below this there will be a one opening is there, which is known as the fish eye valve, and this is known as the mask. So whenever you are going to provide the ventilation, so what you have to do is, there is no need to press the ambu like this. This is the incorrect way of giving ventilation. So whenever you are going to press the ambu, you have to press the ambu approximately, it is 1/3, because our lung is having a tidal volume of 500 to 600 volume. So suppose if you are going to press the ambu like this, so that means you are giving excessive ventilation to the patient, and because of this what will happen, the person will suffer from the atelectasis condition, which is known as your collapse of lungs. So to prevent the patient from the atelectasis condition as well as the gastric inflation, what we can do is, we can deliver the breath 1/3 you can press, then release. Then before you are going to give the second breath, what you can do is, you can count for the 5 seconds, 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, and then again you can give the second breath. So now I am going to show you how you are going to deliver the ventilation with the help of ambu. So what you can do is, this portion should towards the nose part, and this will be towards the mouth aspect. So what you can do is, you can cover the nose and the mouth aspect, and with the help of EC clamp, this one is the E and this one is the C. So with the help of C, you are going to seal the mouth, and with the help of E, you are going to hold the jaw part, and with the help of this E only, you are going to give head tilt and chin lift maneuver to the patient, so that the airway will become patent. And what you can do is, by maintaining EC clamp and by giving head tilt chin lift maneuver, then you are going to deliver first breath. After giving first breath, now wait for 5 seconds, 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, deliver second breath. That means you have delivered first breath, wait for 5 seconds, then deliver second breath. So this complete mechanism, like 30 compression and then 2 breath you have to deliver. And the next aspect is about the AED placement. So right now I don't have any kind of AED, so I'll tell you the basic component of AED also, so that you may get an idea about the AED aspect also. So AED is basically an automated external defibrillator. So AED and DFAB, these are the two things which we are commonly using in case of the patient. So in AED and DFAB, the main functions of AED and DFAB is same, that is to normalize the cardiac rhythm, but there are slight difference. AED we are using in case of the community setting, and DFAB is basically for the in-hospital scenarios, because in hospital setting we have to use this with your DFAB, and in case of community-based scenarios you can use the AED one. So in Indian scenarios you may not able to find AED, but in foreign scenarios you may get AED in the roadside also. So AED is automated external defibrillator. So where we are going to place AED pads as well as the DFAB pads, here you can see this one is the first nipple and this one is the second nipple. So whenever you are going to place the AED pad, the first pad will be above the first nipple, or we can say it is sternum, and second pad will be, it is below the second nipple, or we can say apex of heart. So this portion is known as the apex of heart, or we can say below the second nipple, and this is the area where you are going to place the second pad of the AED or DFAB. And below the first nipple, and that is in the sternum area, there you are going to place the first pad. So the first pad is in the sternum and second pad is in the apex of heart, and here you are going to place the AED pad. So AED will gives you a command and you have to follow the commands of AED. But in case of DFAB, the DFAB is a manually operated device. That means manually we have to operate the DFAB, and then manually we have to deliver the shock. For example, suppose we are using AED. So in case of AED, there are two buttons. First one is red button and second one is green button. Green is on and off button, red one is a shock button. So first what you have to do is, you have to open the AED pads, paste it over the specific area. But before pasting the pads, you have to on the AED machine. So what you will do is, you will click on the green button, then AED will gives you a command, that is apply the pads on the patient bare chest. So what you will do is, you will apply the pads on the patient bare chest. Now the AED will gives you a command, plug in the connector. Now you are going to plug in with the connector. Again the AED will gives you a command, that is analyzing heart rhythm. Rhythm is analyzed. Then stay away from the patient. Stay away from the patient. Then it will gives you a command, charging. After charging, deliver shock. So delivering shock, you will press the orange button. Shock is delivered. Then again you have to start with the compression. So this is how we are going to use AED. And in DFAB is a manually operated device. So there are two types of DFAB we are basically using. First one is your biphasic DFAB, and second one is your monophasic DFAB. So biphasic and monophasic. Previously we used to prefer that is your monophasic, but nowadays we used to prefer the biphasic DFAB, because in case of monophasic the current is flowing in one direction. In biphasic the current is flowing in two direction. Because of this, in biphasic the joule is lesser than the monophasic, because in monophasic we used to prefer 300-350 joule, but in case of biphasic the joule will be 150 to 200 joule. So this much joule will be required in case of the biphasic. So there are two modes in biphasic DFAB. First one is AED mode and second one will be the manual mode. So whenever you are using the DFAB in hospital setting, always click on the manual mode. You will click on the manual mode, set the voltage, remove the pads, apply lignocaine jelly, apply the pads in the sternum and in the apex of the heart. Then you have to give a command, I clear, you clear, all clear, press the orange button, shock delivered, and then resume CPR. Then again you can start with the CPR process. The next thing is, this is about the AED and the DFAB technique. So this is a whole concept about the CPR as well as bag mask ventilation, AED and the DFAB. There are a few more things whenever you are going to apply the DFAB and the AED. So what we have to do is, whenever if you feel if patient is having a hairy chest, in case of if you are applying AED, so there are two pads in AED. So first pad you can apply and you can do the vaccine, and for second pad you can deliver the shock. With the help of second pad, deliver the shock. But if you are in hospital and you are using with your DFAB, the patient is having a hairy chest, so you can use clipper and you can remove the hairs fastly and then apply the DFAB pads. If patient is having a pacemaker over here, then you can apply the DFAB and AED pad just below the pacemaker, not over the pacemaker. So always remember this thing. Suppose if patient is having a medication patch or nicotine patches and transdermal patches, so what you can do is you can remove the patch first, then wipe the area with the help of the normal cloth, and then apply the pads. If patient is having a perspiration in the chest, then what you can do is take a clean cloth, wipe the area, then apply the pads. So these are the specific recommendations which you have to follow while you are going to apply the AED or the DFAB pads. So this was all about the basic life support. But before completing this whole session, I'll give you again a brief idea how you are going to approach the patient and how you are going to start with the compression. So what you can do is, first you have to come to patient bedside, then you have to go with the scene safety, check for the consciousness. Hello sir, are you okay? Are you able to hear me? There is no response, then you can call for help. You can call someone that you can go and get AED and call the ambulance. Now what I will do is, I'll check for the pulse as well as for the breathing. So I'll palpate the carotid pulse and I'll see for the chest rise. There is no pulse, no breathing. Start compression. Below the breastbone, 2 fingers above the xiphoid process. Now 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 30 compression. Now you will move towards the mouth area, pinch the nose, give head till chin lift, deliver first breath, wait for 5 seconds, 1 1000, 2 1000, 3 1000, 4 1000, 5 1000. Deliver second breath. So this is how you are going to give the compression as well as the ventilation to the patient. When patient is unconscious or patient is not responding, then you can start with this mechanism and always follow if patient is having a pulse or respiration or not, and then you can continue with the CPR process. So this was all about the CPR, back mask, AED and DFAB. So thank you so much.